Good evening and welcome to Doctors on Call. I'm Dr. Mary Owen, Associate Dean of Native American Health and Director of the Center for American Indian and Minority Health at the University of Minnesota Medical School. I'm also a family physician for the Fond du Lac Band of Lake Superior, Chippewa. I'm your host for our program tonight on women's health and female cancers. The success of this program is very dependent on you, the viewer, so please call in your questions tonight or send them in ahead of time to our email address, ask@pbsnorth.org. The telephone numbers can be found at the bottom of your screen. And our panelists this evening include Dr. Michael Cassine, an obstetrician gynecologist at Essentia Health, Dr. Sandy Stover, a family medicine physician and faculty member at the Medical School Duluth, and Dr. Addie Vittorio, a family physician with Aspirin St. Luke's Clinic. Our medical students answering the phones tonight are Jessica Crossan from Hugo, Minnesota, Danielle Santos from Smithtown, New York, and Brooke Wilson from Prospect, Illinois. And now on to tonight's program, Women's Health and Female Cancers. Welcome, you three.
Thank you for having us.
So we don't have our audience questions yet, though the students tell me they have plenty. So until then, what's something that you'd like the audience to know today about female health or women's health, female cancers?
Well, I'm a very big fan of the vaccination for human papillomavirus, the HPV vaccine, just because it's one of those things for cervical cancer that's really decreased the amount of cancers that impact women's health and ability to have pregnancies go easily at delivery time. It's also, that particular virus also seems to be increasing the risk for colon cancer as well as some of the throat cancers we're seeing at younger ages than we saw 20 years ago.
Okay, and I don't think people are necessarily as aware of that, and it's not quite as new as it used to be, HPV vaccine. We've had it for how long now?
15 years maybe, 20
Okay.
I was in medical school.
Yeah.
Since you were in medical school, okay.
I think the big thing has been the stretch in years. It used to be considered just up to into your 20s, but now the vaccine is still very valuable for folks as they get even up to 40.
Great.
Mm-hmm.
I think what I'd like people to know is that we focus a lot of our female healthcare on sort of the reproductive years and the younger patients, but actually the majority of things that can adversely affect women's health happen beyond that. So don't forget about yourself as you're raising your children and you're getting into that age where you no longer may see your OBGYN or your delivering provider, that there are lots of things to screen for, test for, and address as you age.
How often should women be going in for exams or health care, at least?
Well, I typically recommend that most women over 50 go in every year.
Okay.
And before that, I think it depends on what your risk factors are, whether there's obesity or other family factors at play, but at least every 2 years.
Okay. But 1 year at 50, basically, is what you're coming. Anything to add, Dr. Cassie?
Yeah, as Addie said, there seems to be a time period where women, essentially between the ages of 35 to 50, when they're done having children, that they kind of are lost to care.
Okay.
And we know, first of all, that the number one killer of women is heart disease. And that's obviously something that's screened for in all the primary care visits. Of course, breast cancer screening is very important as being the most common cancer. And then, lung cancer and skin cancer and colorectal cancer are all very common cancers that can show up in younger women, and we are seeing that more frequently.
Yeah, right. Some things are changing. So, timely question, should I be doing monthly self-breast exams? Dr. Cassie.
So that is a very good question. And we were taught them in medical school, and then for a while they were going away from them. My opinion is that it's a free exam, and if women know what they're feeling for, and if they examine themselves regularly, they will feel a change. So I don't think that there's any harm to doing it. And like I said, it may find something that you may have missed.
So in younger women, we typically recommend self-awareness. So that would be knowing what your normal is, knowing how that varies throughout your menstrual cycle, and then knowing how to identify what is abnormal at any point.
Great. This is a good question. At one time, I think it's changed for generations of women, but do I need to, and if I do, how do I clean my vagina?
I think that is actually a really good question because it has varied what the recommendations and what some of the popular websites or other information might say. But the vagina is built to maintain an environment, or we call it a biome, where the bacteria that are in there are in good balance. And there are things that can affect that balance. being ill or being on antibiotics or both, can change the pH to enough that you can have a yeast infection or other things. But what has been clear over time is that some of the vaginal washes that were popular for a while actually reduce that nice balance that keeps things. It's kind of like this will sound kind of funny, but like a healthy garden. You know, if you have the things growing in there in the right environment, you're going to have that stay healthy and not have unexpected growths of other bacteria or other things like yeast.
I would agree, less is more with this. And so you wash, your normal skin like you would wash your skin to reduce the amount of bacteria and fungus and yeast and other things that grow on us. But you don't necessarily, wash the inside of your vagina with a soap or detergent, much like we would use toothpaste on our teeth, but we're not necessarily cleaning our mucosal tissue inside our mouth either.
Yeah, there's no indication for the douche, I think is
Right.
something to know.
Okay, it's why they're not sold as much anymore.
It's not supposed to smell like flowers.
No.
It has a smell.
Well, there's the new spray too, which is
I know.
also kind of bothers me a little bit in that there are normal smells that
And it can cause other problems,
It
like
can cause other
bacterial
problems.
vaginosis,
Yep,
right?
yep.
Just like bubble baths sometimes for some
Yep.
women, right? Here's a question. What are some critical aspects, let me put these glasses on, folks. What are some critical aspects of maternal health that new mothers should be aware of? Start with you, Dr. Cassine.
Well, I think the biggest thing is awareness, like Addie had said, with changes in your body, because a lot of women don't know that they're pregnant for a long time. Nausea, vomiting, fatigue, and breast tenderness are the most common symptoms. And knowing that and having those changes would prompt a woman to maybe take a pregnancy test. Once a woman determines if she's pregnant or not, I think accessing prenatal care, and thankfully we live in Minnesota where pregnant patients are covered, even if they do not have insurance, and we have two wonderful systems here in Duluth, two nice hospitals to choose from, that accessing prenatal care really sets the patient up for success. Mm-hmm. So the one thing I would say is be aware and access prenatal care as soon as you know that you're pregnant.
Yeah. And I would say that's a time when you know you are pregnant to call your primary doctor before you've established someone that you're going to deliver your baby with, to say, I'm on medicines, are these safe for pregnancy? What should I be doing for supplementation of folic acid or multivitamins? What are my risks for gestational diabetes? How can I keep a healthy lifestyle so that it betters the success of my baby and myself throughout this?
And a lot of primary doctors deliver babies.
Yep.
Thanks. Yes, we do. Lots of
Yes,
us.
you do.
I want to follow up on something that you said, though. One thing that I've noticed through time is a lot of with prenatal visits, that some people are fearful of going in to see the doctor for whatever reason. But that's a time, it's not about judging our patients for whatever else is going on in their life. It's really about a time that we're there to take care of them. So it's good for them and baby, no matter what's going on.
Well, and even with anticipatory thinking in that time when you may want to be getting pregnant, that's a great time to talk with someone about staying healthy and going on prenatal vitamins for those early weeks when the baby is just forming.
Yeah, and our goal is to support that pregnant person where they're at. And so we're not there to be punitive. We know that people get in relationships and become pregnant that are not successful or healthy relationships, and it's our time to support that woman as she goes
And
through
we
that.
know that people drink alcohol, and when they don't know that they're pregnant. So it really needs to be a non-judgmental time.
Excellent. I think you'd all three be good doctors for this. Dr. Stover, what's the significance, that's a good question, what's the significance of a positive HPV result? I'm a 35-year-old woman with a positive HPV result. My doctor mentioned an HPV vaccine.
Yep.
Should I get it? So
well,
first
and that is a great question because HPV is quite common, and it's in the wart family. It's not the same kind of warts we get on our hands. It's a different cousin to some of those warts. But that particular, there's a couple of variations on the HPV virus that are more likely to lead to abnormal growths that can become a cancer. We have found that with the vaccine itself, even if you've already gotten HPV, getting the vaccine can help you because there's some cross-reactivity with those different subtypes, and so the vaccine is real helpful. And then what's important as well is getting regular checks for pap smears and rechecking the HPV to see if it's active. Our bodies are amazing, and the HPV virus can come into a steady state, as many other viruses do that we come in contact with. But the vaccine can help that, as well as regular monitoring to make sure that we can nudge it away from potential for developing something like a cancer.
And I tell all my patients, especially in their 20s, expect an abnormal result at some point. And don't worry about it, address it, follow up on it, but don't necessarily view it as something that is going to turn into something bad. That's the purpose of screening, is to find at-risk conditions so that we can initiate monitoring of those things.
Yeah, it seems like the theme of the night is communication. Talk with your doctor and we can help reassure you in a lot of cases, almost all cases. So speaking of reassurance and help, do you have any advice, I'm going to go to you, Dr. Cassing, do you have any advice for women with a new cancer diagnosis about how to engage with the healthcare system?
Yes. As Dr. Vittoria said, the primary care providers are fantastic in that they are the quarterback of the medical team. We have...
Keep inviting this guy on the show, huh?
We have a number of fabulous women's health providers at both facilities, Essentia and Aspirus. And
other healthcare places.
Other healthcare places too.
Like Fond du Lac.
Fond du Lac. Mm-hmm. Sorry, I was thinking actually like the oncologist. But
okay.
Yes, reach out to a provider and they will know what to do. Or if they don't know what to do, they will figure it out or figure out who to send you to that then can figure it out. I think when you hear cancer, you assume, terminal disease and really bad outcomes and interventions, and that's not necessarily the case, especially when found early. A lot of cancers can be treated.
Yeah, good. Anything to add?
I think there's also good communities that some of the navigators within the systems, particularly for a more common cancer like breast cancer, can help develop some of those support groups that can also help walk that path with you. And so I think it is a team again, and having your primary care quarterback, I like that idea, is helpful. They know you well and they'll follow you past that cancer and continue to understand how that impacts your life.
Yeah, and I think probably the worst thing you can do if you suspect you have cancer or you do have a cancer is to ignore it and kind of fear that discussion and treatment, because we see so many women who, they're over 60 and they have vaginal bleeding 10 years after their period, and they sort of worry, but they don't address it. And we can address these things early, so we actually have to treat women in a less invasive manner.
This sounds exactly like what we tell our students, Sandy. Yeah. If you think there's a problem, come talk to us, and then we can help you through it.
Yep.
Same with our patients. What were you going to say?
I was going to say, kind of piggyback on Dr. Vittoria, is any postmenopausal bleeding should be addressed. So if a woman has gone a year without a period and then has vaginal bleeding, they need to be seen.
Yeah.
The evaluation is pretty straightforward, and if you do have cancer of the uterus, it's in general very treatable. Okay. So it's one that if you address it early, it really does affect the outcome.
Yep.
And it is one of those cancers that we are seeing increase, because we do see some factors like obesity make the bleeding and the cancer more likely or common.
There are also reasons for bleeding that may not be cancer but are equally important to treat, and that can have to do with menopause and some of the dryness that can occur in the vagina can. So not all bleeding is bad, but all bleeding should be checked out to help manage the body's ability to support itself. Yep.
Yeah, no reason to sit in fear
Exactly.
with these questions that you're having.
Yeah.
Good. So Dr. Vittorio, should I make any dietary changes as I age to maintain bone health and muscle mass?
I think the most important thing is start as early as you can, because we know that you were born with a certain bone density, and then throughout our life we have a cycle of estrogen and progesterone with our menstrual cycles, and that's your time of peak bone building. So from the time you're 12 or 13 and get your period until you're in your late 40s or early 50s, that is when we build all of our bones. And then after that, we actually see the body sort of naturally take calcium and other minerals from our bones, and we see less bone density over time. So the best time to start building bones is earlier. We want all people to consume adequate calcium. That doesn't mean you have to take a supplement. Most dietary calcium is actually much more bioavailable or available to the body. So it's important to get sources of that, whether that be vegetarian sources or through dairy And then vitamin D is important. There was a big focus on vitamin D about 10 years ago where we really got quite aggressive with vitamin D. And I think the biggest thing is, make sure you have a good source of vitamin D. And then when we get sun around here, expose yourself to safe sun on a regular basis.
With sunscreen.
Yes. And exercise is important, and we should all be exercising throughout our lifetime. There's not a time and place during a visit at a certain age where I say, now you need to start exercising, or now you need to start taking calcium and vitamin D. We should assure that those things happen as early as possible.
Good. Dr. Cassine, what are common menopause symptoms and what treatment options are there?
So the classic symptoms of menopause are hot flashes, night sweats, sleep disturbances, and vaginal dryness. There are many other symptoms that can be related to menopause, but those are generally the cardinal symptoms. There are many treatments, and we can go into behavioral modification, dietary changes. There are medications, both hormonal and non-hormonal, that can be used. So it's a big topic right now. It's all over TikTok and Instagram, and we're prepared to handle it. So if patients are having menopausal symptoms or think they have symptoms that may be related to menopause, come on in, and we're happy to talk to you.
Yeah, and I think it's helpful to talk to us about that, because there is sort of some misconceptions about when perimenopause starts, when menopause starts, when it's treatable with or without hormones, or what symptoms might be improved with treatment and what symptoms actually may not be improved with treatment.
Additionally, it's very individual, isn't it? We know that now. Good.
Absolutely. What you experience and then how you should be treated is different for every patient.
This question is, I get a lot of patients who come in with a lot of fears about birth control pills. Can you give your perspective on what birth control pills do to a person's body, Dr. Stover?
Oh, it's a good question. I mean, birth control pills have been out since, even in the 50s, but the 60s they became popular in the United States. And there are levels of estrogen that are involved in most birth control pills. There's progesterone as well in most of them, in various balances to that we pick to match to what a woman's need would be. The idea of what they do is they basically sort of take over the hormones that the ovary would normally be doing. So the ovary kind of goes into vacation mode, And in that process of being on vacation, it doesn't make any eggs. And if you're not making any eggs, you don't get pregnant. So that's how they work. There are side effects to everything that we do. The side effects to birth control pills are relatively minimal, definitely relative to a pregnancy that you're not quite ready to or not planning for at that point in time. But the side effects can sometimes impact headaches or clotting issues in your body, and we screen for that when we work with women to make decisions about their reproductive choices that they have. There are other non-hormonal ways that we can also help manage people's choices, manage reproduction too.
Anything to add to that? No? Okay. Dr. Vittorio, what are normal period symptoms, and when should I be concerned? What's abnormal, in other words, I think they're asking?
Yeah, and I think that's individual as well. So normal period symptoms are mild cramping, some mild mood changes before that. Some people experience bloating or water retention, and then the obvious, which is the bleeding vaginally. But what is not normal kind of depends on who you are and how well you tolerate menstrual cycles. You should not be vomiting with your menstrual cycle. You should not be going through a pad or a tampon every 1 to 2 hours with heavy bleeding. If you are finding that you regularly offend your relatives, your spouse, other people at work because of your menstrual issues, that is not normal. But it all depends on sort of where you fall on that spectrum.
Okay, great.
I would say that also women will experience menarche or their first menstrual cycle, anywhere between in their early teens, roughly. And it can go several years on either side, but 13, 8 to 18 is still reasonable. But women will develop a cycle, and what is usual for them, while it may be heavy, it may be painful, they experience that. Well, some women have a lighter period. The point is, if you have a change in your cycle, we know that oftentimes women will have a change in their cycle when they start the birth control pill, when they have a baby, as they get older. So monitoring a change in your cycle, and again, similar to the breast discussion is just knowing what is normal for you. And just because it's normal for you doesn't mean you have to tolerate it. You know, we can usually make symptoms better.
I'm surprised at the number of my patients young patients now that monitor themselves on their phones. It's I feel like it's far more than when I was a young person. So
Yeah, and I
it's
think
great.
it's important to know, like in the teen years, abnormal is normal for a lot of teens.
Yeah.
So, you know, some people will get their period and not get it for 4 or 5 months when they kind of first start their menstrual cycle. Some will get regular bleeding right away.
There could be other kinds of moodiness that will settle into a more even-keeled pattern that is normal for you. So those first couple of years of menstruation, again, it's helpful to talk to family members who you may share a similar pattern with, and it's helpful to talk to a physician so that you can consider what might make it easier through that time period.
And also the last couple of years.
Yes,
Very,
yes.
very
yes.
unpredictable and difficult to anticipate.
Okay, Dr. Vittorio, what is endometriosis? And what's the treatment?
Yeah, so endometriosis is the growth of abnormal endometrial tissue. Endometrial tissue is the center lining of the uterus. We have an endometrium, a myometrium, and an external layer. And this layer can deposit itself on abnormal places inside the abdomen. And so when women menstruate or get the hormonal signal to have symptoms in their endometrium, they can develop that on their bowels. They can develop very painful cycles that involve some GI symptoms. They can develop internal bleeding, small pockets of that. It can be genetic, so it does run in families. Treatment ranges anywhere from taking control of the hormones with birth control pills to actually going in surgically and removing spots that appear and or organs that are damaged by that.
So a wide range of symptoms and treatment. Good. Not good for the women who have it. Dr. Cassian, how often should I be checked with my diagnosis of Lichen sclerosis?
That's a very good question. So lichen sclerosis is a chronic condition of the external genitalia, and the answer to that is if your symptoms are controlled once a year is fine. And usually you have to come in for a steroid cream refill or something like that anyways. Again, a similar theme we've had throughout the show, if you have a change in your symptoms or if your treatment that was working isn't working anymore, then that would be a sign that you should come in to be seen sooner. But generally once a year, especially if you're on a stable regimen, is plenty.
Okay. Dr. Stover, does baby aspirin prevent preeclampsia, and is it beneficial to take during pregnancy?
Another good question. The preeclampsia is where blood pressure can rise greater than it should during pregnancy, and it's actually related to a feedback loop that involves the immune system, involves the kidney, involves the liver, and that it has been found that aspirin in people who are at risk for developing preeclampsia, it can help reduce that. And I'll definitely, Dr. Cassian, what else would you add to that?
Yeah, no, this has been kind of a real development in the last 10 years. And it's almost like who doesn't qualify for aspirin. So if your doctor does recommend, or your midwife, a baby aspirin, it's certainly very safe and could be helpful for you and is unlikely to be harmful.
I'm hoping Dr. Jean Riegel's watching the show because we do research. She does research on this at the University of Minnesota. So it's a great question. Thank you for those great answers. And you're a great teacher, Dr. Stover. All right, Dr. Vittorio, I'm a postmenopausal woman. I was on Depo-Provera from 30 to 45 years of age. I recently heard Depo-Provera is not meant for long-term use. Is this true, and should I be concerned?
There are some concerns about the long-term regular use of Depo. We do know that it does affect bone density, but the thing we know is that if you take holidays or if you take breaks from the medication, the bone density rebounds.
Okay.
Well.
Good.
And so Depo-Provera is a progesterone. It's given in injection form, and it essentially eliminates the menstrual cycles. In general, we still use it, and we do generally regard it as safe. We just know that long-term use, you may want to consider an alternative periodically. And
I would say that breast screening is going to be important in that patient, because if there is a risk of long-term Depo-Provera use other than the bone mineral density, it's breast cancer.
Okay. I think we have room for one more question. About 1 minute left. Can you talk about, Dr. Cassian, can you talk about hormone replacement therapy during and after menopause? I'll give you a short one.
Yeah. So hormone replacement therapy is a lot safer than we used to think. When I was a first-year medical student, the Women's Health Initiative came out, and the vast majority of women were taken off their hormone replacement therapy. Hormone replacement therapy in a high number of patients can be very safe and incredibly effective. And when we talk about hormone replacement therapy, we mean estrogen either by itself or with progesterone, and it can be given in multiple forms, including vaginal estrogen. So if your symptoms are not controlled, come in. We're happy to talk to you because it can be safe and incredibly effective.
So that's the theme of the night. Go in and talk to your doctor. You got questions? Find your doctor, right? All right. So I want to thank our panelists, Dr. Michael Cassian, Dr. Sandy Stover, and Dr. Addie Vittorio, and our medical student volunteers, Jessica Crossan, Danielle Santos, and Brooke Wilson. Please join Dr. Ray Christensen next week for a program on men's health, prostate, bladder, and kidney problems. Thank you for watching, and good night.